Teach is a way of ensuring reasonable adjustments takes place. It was developed in Hertfordshire. T is for time. So consider the amount of time you may need that's different to get it right for someone with a learning disability. That in the end will save you a lot more time and have better outcomes for the person. E is for environment. Consider environmental changes. A dimmer switch, a pager so that they can go away and you can bleep them to say that they're the next person in, or a quieter area to wait, or whatever. A, attitude. Your attitude impacts on other people. Smile, be nice. If you think when we first met, one of our colleagues here is wearing purple. I made a point about saying nice colour. For people with a learning disability, very often health professionals don't say very nice things to them. And that's for a good reason sometimes, because things are not going very well for that person, but you can say it in different ways. But saying that breaks the ice and it makes you realise, they realise that you see them as a person. C is communication. Use pictures, signs, photos, symbols. Why not use picture stories? We have it on the motorways. We don't have an essay up there telling us what to do. Why is it so different? Books beyond words, use them. They're brilliant. They will assist you in being able to understand whether someone has capacity or not for what they're going through and what level of understanding they have. H is for the help that you may need to get it right, but also the help that they need and the supports. So think about who else can help me. If you're not a specialist in learning disabilities, find out someone who is. Get the community team involved. Ask a colleague. Think about it, but inherently ask the person and the family and the people that support them that know them best, because they're the experts. We're not. And that needs to change to shape services for the future. We have got to get them right at the core and get away from a professional model of care. It's shared care, but at the core are the experts by lived experience. That's what reasonable adjustments are about. You can all make them. Simple ones. No fixed visiting time in hospital wards for people with a learning disability. Why? Because the experts can be there all the time then. You've got them. They're providing emotional advocacy and support for the person that they know best. The hospital passport saves lives. Use it, read it. The theatre protocol, that's a reasonable adjustment. It's a lifesaver, but it's also a cost saver. It means no longer having to close recovery, no longer to stop having operations and delaying people their right to their care because we're getting it not as well as we should get it right for some people.